Vaccine advisors to the federal government are disappointed and some are angry that government scientists and executives from Moderna withheld data throughout last year's authorization discussions for their new booster. Now, U.S. taxpayers spent nearly $5 billion on the new booster, which has been given to more than 48 million people, despite data indicating the new booster may be even less effective than the original shots. It appears this lack of transparency is becoming a common occurrence, which is only eroding public trust further. With me now to talk about this, Dr. Andrew Bostom, formerly a research physician at Brown University Center for Primary Care and Prevention at Kent Memorial Hospital in Rhode Island. Dr. Bostom, welcome back to Washington Watch.
Thanks for having me back, Tony. Happy New Year.
Before we get into this COVID booster data, it's great to see you out of Twitter jail now that the old regime is gone.
Yes, it was bizarre. It's maybe a tale for another time, but yes, I'm very glad to be back.
So you've written about this extensively. Can you walk us through the data that was withheld during the booster approval negotiations, that whole process?
Yeah, I'm a little surprised that this story has taken so long to evolve. I mean, I guess it says something about the journalists that have refused to cover these stories. Tony, these data. It's also weird how the committee that was overseeing wasn't provided these data during the hearings about approval, because in short order, the formal paper with these analyses was published back in September in the New England Journal of Medicine, and basically they looked at the data in two ways. If you considered the entire trial group, the rates of infection in the boosted versus the non-boosted group were identical. They were about 2.5% in each group. If you looked at the group that had not had a prior SARS-CoV-2 infection, so they had no natural immunity, they actually did worse with the booster than the people that had not gotten the booster. And that really, that result, you're now seeing some of these scientists that I think were even involved with the approval process complain about. But, it's, I don't know, I'm really kind of suspicious. If the public had access to these data, as in September, there should have been an outcry, at least when the paper was published, by these same, if they made a mistake, if they were not given these data and somehow they went to publication after the approval had been made, and as soon as the paper came out, they should have said, we're going to reconvene the committee because now we have the results, and we should not have approved this. By the way, Tony, the other thing is, because we're in the Omicron era and the disease itself, the virus itself has attenuated so much. There weren't any severe cases in either group, whether they got boosted or not. So it's something's not missing something's missing from the story.
Right. And then when you look at the announcement that they're extending the public health emergency for COVID for the 12th time, I mean, am I wrong in saying that the confidence of the American people in our healthcare system, at least at the federal level, is eroding because of stuff like this?
They're destroying it, and then the states, like my state, unfortunately, is one of them, that basically adopt a cookie cutter approach to whatever the CDC says. These local states, and let's be honest, they by and large tend to be blue or bright blue states. They're destroying confidence locally. So it's happening. It's a double dose of really instilling cynicism.
Dr. Bostom, let me ask you this. I mean, you just talked about this. This research was published in a public journal.
Yeah.
So how was it this was missed? I mean, they didn't talk about it. Apparently, they didn't give it, didn't spoon feed it to these advisors. Moderna experts or their executives didn't want this to come out. But how did this come to light? And is there a lack of transparency when this type of stuff is being approved?
Well, there's multiple issues. It should have. They obviously, if the data were ready to go to publication, and publication still takes at least a couple of months or something like that. They had these data available that they could have shared with the advisory committee. But when they finally appeared, I mean, what can I tell you, Tony? I blogged about them, but you know, the
But
media,
you were in Twitter jail.
Yeah, well, exactly. I had them on my blog, but the media should have picked up on this. Why did it take
Yeah.
CNN to do a story? What was it, yesterday or the day before, when these results were available in the New England Journal? You know, in September.
Collusion.
Yeah, you've got to say that they're not journalists. They're basically functioning as press agents for the CDC, et cetera.
Yeah, it's shocking. Well, I'm grateful that there are medical professionals like yourself out there that are willing to tell it like it is, to alert the public. Dr. Bostom, always great to talk with you. Thanks so much for coming on today.
Thank you, Tony. Take care.